Oh, that's nice.
Hi, this is Sean and Carolyn. I'm going to give you all a few more minutes before we start up. If you are joining by phone, please mute your phone so that there will be no interruptions during the presentation. Please hold your questions till the end. Is there anything else I've missed? Go ahead.
That's it, I believe.
Okay. Also, if you're joining by a computer or with your Skype, please mute your microphone so that no noises are coming through while we're doing the presentation. We would really appreciate it. And we will begin here in just a little bit.
Good afternoon, everyone. My name is Carolyn Wright. I'm a health scientist in the Program Evaluation Branch at CDC. I'm here this evening with my colleague Sean Balladier to provide instructions and guidance on completing the HIV test form that is being implemented statewide as part of the National HIV Prevention Program Monitoring and Evaluation Activity. The requirements presented in today's webinar were developed in support of HIV prevention activities under the new Integrated Surveillance and Prevention Global Funding Opportunity, PS 18-1802. The requirements were also developed to allow recipients to look at the things you want to look at the local level, and also to provide with the information needed to look at program data at the national level.
If you're doing by phone, please mute your phone. We can hear some feedback. Thank you.
We've outlined today's training to mirror the sections of the new HIV test form, which you all should have by now, should have received by now. The first sections of the form, the cover page, are the general instructions, and the next sections provides information about the site and the agency, the site being the location where the HIV test is conducted. The next couple of sections are pertaining to the client's information, the client's demographics, client's address, anything specific to the client. The next sections provide information on the HIV test itself, the test results, and any additional tests that are conducted in conjunction with the HIV test. The next section is for PrEP awareness. There are a few questions that are new to the HIV test form that we ask to gauge a client's awareness of PrEP and their usage of PrEP. The next section is for priority populations. These variables are also new, and we will give some instructions on how to complete those on the HIV test form. We will wrap up with instructions on how to complete the essential support services, local use fields, and fields that are designated as health department use only on the HIV test form. But before we begin, I want to reiterate, if you are not muted, please mute your phone lines. We are recording this session for future use. So if you have any cell phones, any mobile devices, or any other electronic devices that make a noise or can pick up sound, please mute them now. And we also ask again that you hold all questions until the end of the webinar. We want to make sure we get through all of the slides. We will have a question and answer session at the end. So to begin, we will start with the general instructions. The cover page of the HIV test form provides basic guidance on how to complete the form, as well as contact information on where to obtain additional forms if more forms are needed. It also includes the address to where you mail the forms, mail your completed HIV test form, and also the time frame in which to mail them. The cover page also includes some basic do's and don'ts when you are completing the HIV test form. I won't read through all of them, but I will emphasize the last bullet on the do column that reads, do complete all sections for each client as appropriate. This is important. We want all variables that are pertaining to an HIV negative test or an HIV positive test completed on the form. Once these are entered into the system, there are certain variables that must be completed or must have a value in order for the system to save a record. So it's important that every field on the form be completed. On the do not side of the form, I want to emphasize the last do not bullet, which is do not make copies of the form. This is important because the test form has a unique identifier, which is called the form ID. This will be in the form of pre-printed labels attached to each HIV test form. We do not want you to make copies of the completed forms. That number is unique and it cannot be duplicated. If you need additional forms and additional blank copies of the form, you can reach out to someone at the state and they will provide those to you. You can make copies of completed forms for your internal use. Just do not make copies to reuse for another client. Also, be mindful of how you're completing the form. You should use black or blue ink only. Do not use red ink. Do not use a pencil. Black or blue ink is acceptable for completing the form. The next and agency information. Again, the site information is where the HIV test is conducted, so it is important that you complete that information completely and legibly on the HIV test form. Going back to letter A, which is at the top of the screen, that is the form ID that I just mentioned. That is the unique identifier for the form. The state will provide that number to you. You will have pre-printed labels attached to the HIV test form. The CLIA ID number should also be completed if you have or know your CLIA ID number. Include that on the test form as well. Letters C through I are important to be completed because this is how CDC, this is how your state health department teases out records that each health department has either entered or funded under 1802. Letter C is the session date that corresponds to the date of the HIV test. Letter D, the program announcement, is the funding stream. This is what is used to determine which funds are used to pay for an HIV test that's administered to a client. For the most part, the tests that you administer will be coded under PS 18-1802. But you still must indicate that on the HIV test form, so the person entering your record will know that 18-1802 should be entered into the system. Again, letters E, F, and G pertain to the agency and the site. The site, again, is the location of where the HIV test is conducted. Letter G, the site type, corresponds to the site name. And you'll have a grouping of site codes on the back of the HIV test form where you can determine whether the site should be categorized as a clinical or non-clinical site type for testing. The address is something that is not submitted to CDC. We do not get that information. And also letter J, the local client ID, that information is not transferred to CDC. That is an identifier for the client. It should be a unique identifier for the client. It should not contain any personal identifying information, which includes the client's name, address, phone number, social security number. Any information that can link back to an individual should not be entered or written in the client ID field. The next section we will cover is pertaining to client information. This is where the client completes their name, address, phone number, email address, birth date. None of this information is transferred to CDC. We only receive the year of birth of the client. We do not receive the name. We do not receive their address, phone number. So any of this personal information that you document on your client will not be submitted to CDC. This is for internal use only. This is used for you to track your clients and make sure you have a unique record for your client. Section 4 is the client demographics. This, again, is information that is completed for the client, or the client can complete the information for themselves pertaining to their ethnicity, race, assigned sex at birth, current gender identity, and their prior testing history. Now, for some of these variables, you'll see options for don't know or decline to answer. This is meaning the client does not know or the client declines to answer, not the tester. So we want you to ask these questions of the client. We want the client's perspective on what they consider or how they classify themselves in terms of race and ethnicity. So if the client does not know and don't know is selected, that we will interpret that as the client does not know their race or ethnicity, not the tester. For the testing history, there are two questions: HIV test in the last 12 months and if the client has ever had a previous HIV test. for both of those responses, the date responses, if you or the client does not know the year, you can enter 1800 as the year for the date of the test. This will be accepted in the system when it's entered. The date format is a month-year format. So again, if the year is unknown, you are permitted to write in or enter 1800 as the year. And the valid value options for each variable will be presented on the HIV test form as they're shown here.
The next section is the final test information. There is 2 sections here that will need to be filled out in the next 2 sections, which is the final test information and the lab use only section. So first we'll start with the final test information. Here in the first column is where you would indicate how your test was run. Was it anonymous, which means if you are doing an anonymous test, you will not need them to enter anything into the yellow sections above in client name. You will try to get client demographics if possible, but you will not collect any identifying information. If it's a confidential test, they can enter in their information in both sections above in the yellow sections under client name and contact and client demographics. If the client is only wanting a counseling about STDs or HIV and they are declining to have an HIV test, you would test not done there and the reason why is below it. If you are conducting in the next section, section D, if you are conducting a CLIA-waived point of care rapid test, which can be done with oral fluid or a finger stick, here is where you would indicate what the results of that test would be, which would either be a preliminary positive or a negative, or you see the other choices there. The next section would be if you were to send out, which they call a laboratory-based test, which is conventional. That is a blood draw test. You will have stickers to be able to associate this form with the vial of blood that you're sending out to the Office of Laboratory Services for free blood testing for HIV. And here's where you would indicate the results that are given back by OLS. In this last section here, section E, you would indicate if the results was given to the client, if the client was contacted, and the results of the tests were given, both positive and negative. In the next section is lab use only. You will need to fill this section out as well. We have preliminarily put down the testing kits we use. If you are using another test kit besides NC or a Quick or a Lear, you can mark out one of those and write the name of the test kit that you are using in the blue section. Here's where would you indicate if it was a negative or a preliminary positive. This is for rapid testing for these first 3. If you are using another test kit as a confirmation test, this is where you would indicate what was used, if it was oral fluid or blood stick or a finger stick, and what the results would be. If then you get to the if you are send out blood for a final confirmation test, or if you're only doing a blood draw test, you would indicate here in additional testing confirmation in this section what you did and where you sent it, and there's a section for sending to LabCorp or OLS or a link to CARE. The final test result would need to be put in this section here, F, for what the final test results was and how the follow-up was done with the client or patient. Make sure you're filling out both of those sections. Even if you're doing an anonymous, we will still need to know what the outcome of the test was. Was it positive? Was it negative? And was there additional testing done for confirmation? In those first 2 sections under final test information and lab use only. We're now going to the section for a negative test result. This is where you would indicate what was done as part of your negative test result counseling with your client. You would list here if the client is at the at-risk population, and which as we know, is MSM, people who inject drugs, PWID, and those who have drug addiction problems. Those are some of the high-risk populations for our state. If they meet those criteria, or what you would consider the criteria in your area for a high-risk population, please indicate that here. The next section is where you would talk about, if you talked over with them, if this was a negative test result. You want to make sure you follow up with them about getting in some preventative services and getting some preventative care. If you're talking to them about their PrEP eligibility. The next section, if you offer them a PrEP referral to somewhere in your area as considered by your local criteria or for CDC. Section D is if you actually gave them the link to a PrEP provider in your area, you would indicate that there. And any kind of linkage to a PrEP provider, even if it's outside of your area or in your area, you would also indicate here yes or no in sections D and E. In the next section is for a positive test result. This is something you will do with your positive patients that you get a positive test result back on. And this is where you would indicate if the client attended their medical services once they were linked to care. If you do not have that information, you would be able to obtain that from your DIS worker there, or your managed care, your care worker there from the Ron White program, or Medicare, Medicaid would be able to help you with that and make sure that after they were linked to their DIS and they were linked onto care, you'd be able to get with your DIS to get this information. If it's a positive, and they're usually self-admitting they are a positive or not, this is where you would indicate that in section C. If they indicated to you they were a past positive or they knew that they were a positive patient. If you provided any kind of counseling on risk reduction for a positive patient, including partner services or getting those partners linked to a DIS worker so they could be tested. This is where you would indicate that there into the next two sections under D and E. While you're working with your positive patients, you should be asking them and checking on their housing status. This is where you would list that. This is something your DIS worker would need to know, what their housing status are. Are they needing housing? Are they able to reach them or reach any kind of partners they might have, and what their housing status would be? This is where you would indicate that. The highest concern in our state and around the nation is a female who is pregnant and positive. This is where you would indicate that. They need to be linked immediately to care, get into the infectious disease doc to get them on the medication started so that their child is secure and decrease the probability of them being born HIV positive. So those are at high risk, and you would make sure that the information was there and provided to your DIS worker once this case is turned over to them as a positive HIV positive patient. In the next section, we are talking about additional tests. This is the questions you ask the client if they are willing to respond, if they've ever had syphilis, gonorrhea, or chlamydia, and if they've been tested for that before. This also gives you the option at that point to ask if they would like to be. Many of you offer that as well, and we provide that free as well as blood testing through the Office of Laboratory Services that we pay for free at no cost. And the next section is the hepatitis A, B, or C. This also gives you an opportunity to ask your client if they've ever had this, or are they positive for that, or if they've ever been treated for hepatitis A, B, or C. And you can also, at this point, offer additional care if they have, or if they don't know their status as far as being as hepatitis goes.
And I just want to add to the additional tests that you'll note where we have the wording optional in parentheses. Those are for the test results. If you cannot or do not have test results for any of these tests, that's okay. We are not requiring you to document that, but we do want you to document if the test was done. So that is required for each of those tests. So now we get into, Sean mentioned a few of the prep questions that have been added to the HIV test form. Those are added or asked specifically of HIV-negative persons. The three we're talking about now are asked of all clients, and this is to gauge the client's or your patient's awareness and current usage of PrEP. These three variables are intended to monitor PrEP awareness and use in populations served by CDC-funded HIV testing programs. And again, these are new variables to the HIV test form, and they were added to support activities of PS 18-1802. So we want each of these are yes/no variables. Even if the questions don't come up in the course of the interview or the conversation with the client, we encourage you to ask the questions directly. That way we can get a good baseline assessment of how PrEP is being considered in our HIV-funded programs that are CDC-funded.
In this next section is the priority populations. This is some more of the demographics we would need for the PS 18-2 grant. Also, to help you as you are counseling your patient, this would give you some idea of some of the background of the patient and some of the risk factors and their risky behaviors that you could actually counsel them with. And it would be their sexual activity or with males or females or someone who is a transgender, and also their drug use or sexual activity with someone who is a drug user or an intravenous drug user or a substance abuser. This would help you as you're counseling them to be able to give them alternatives and preventative if there is negatives for ways to avoid infection with HIV or STDs.
And if you note in the gold where we have expanded the definitions for sex under 18-1802, historically, sex included vaginal or anal sex only. Under 1802, we've expanded the definition to include oral sex. So when we are asking about sexual activities under 1802, we are meaning oral, vaginal, or anal sex. And also note we've expanded the reporting period for these activities from 12 months to 5 years. So now it's a 5-year recall period instead of 12 months. The last sections of the HIV test form cover the essential support services. These are services that are that you either refer or provide to a client at the HIV testing event. So we're not asking you to track clients over time to get this information. We're not asking you to contact anyone after they leave their testing event. So this is literally what you do during that testing experience for the client or with the client. So, and it's worth noting that the sections where we have, if you look, for example, under letter A, Health Benefits Navigation and Enrollment, we have 3 questions: screen for need, need determined, and provided or referred to the service. These 3 questions are independent of each other. So if you did not screen for health benefits navigation, you can still provide or refer a client to that service. So it's the same across the board with all of these essential support services listed on the test form. We want you to complete this section again for activities or services that you refer a client to, you screen for, or you provide to a client during that testing experience.
And in addition to while you're working with patients, maybe as a current risk factor here in our state, which is people who inject drugs, what we call it PWID, if they are referred to a MAT service, medical assisted treatment, for drug and alcohol addiction problems, you would indicate that they're under behavioral health services.
The next slide also covers more of the essential support services. This covers letters D, E, and F, which are social services, the navigation services, and the linkage services. You'll note that for letters E and F, these are asked or completed for HIV-positive clients only. So if you have an HIV-positive test result, you will complete letter E and F for those HIV-positive clients only. You will not complete those if you have a negative test result. And the last one, again, is medication adherence, which is also completed for HIV-positive clients only. And again, all of these services are included on the HIV test form as a means for us to gauge what services a client is provided under 18-1802. You do not screen for any of these services. You do not document that. If you provide the service, we want you to document that, even if you do not screen for the service. So any services that you provide, any services that you screen for, please document them on the back of the HIV test form. The local use fields are just that, fields that are included for your local use only. These are open text fields, free text fields where you can write in and document anything relevant to the client. We just caution you, since these are text fields, don't enter any personal information in these fields. Nobody's name, address, phone numbers, nicknames, or anything that can be linked back to the individual. We ask that you not include it in these fields. These fields are entered into Evaluation Web, but they are not transmitted to CDC. So again, these are for your local use only, and the information you document here should be something that's relevant to the client or to the client's HIV testing experience. This section is for health department use only, and it is labeled as such because there are a couple of variables that are considered to be personal identifying information. The two letters A are the EHAR state number and city number. These are new variables added on the prevention side of HIV testing. They are variables that are entered into the surveillance system, EHARs. In that component, they are considered personal identifying information. So in order for us to add these to our form, we had to make sure that there was restricted access to the variables. And the purpose of the variables is to be able to connect or link an HIV-positive client's program data or their HIV testing data with their surveillance data that's in EHAR. So this is the mechanism by which we will, on the back end, once we get the data at CDC, make those connections. So if you're entering your HIV testing data and you do not have access to these variables, it's because you're not considered a health department administrator, and someone who has administrative privileges will need to enter this information into the system for you. Similarly, with letter D, the partner services case number. It's considered a personal identifier for partner services cases, so it is behind the administrative function in the system. If you do not see these variables when you're entering data, you will need to get someone with administrative privileges to enter this information or update the record with this information. Letter B is an important variable to be completed because it is how we determine if a record is a new positive or a new diagnosis or a previous diagnosis of HIV. If this is left blank, we have no idea if all of the testing you've done can be attributed one way or the other to a new diagnosis or previous diagnosis. So again, if you are entering these data and you do not have access to these variables, get in touch with someone who has administrative privileges so they can enter this information on your behalf. Similarly with letters E, both letters E, this is the partner services, if the client was interviewed by partner services or for partner services. So we would need to have that information entered as well. And again, if you do not have access to these variables, you can still enter as much of a record as you can. The record can be updated at any point in time in the system once it's entered with this information. So on the back end, someone who has administrative privileges can update this information. And this screen just covers what I just mentioned about Department of Services variable, Department of Services case number being a personal identifier behind the administrative function in the system. So if you do not have access to these variables or don't see these variables on your screen, someone with Health Department administrative rights would have to enter that information for you.
In the next section, this is for your information to help you fill out this form. We have given you some of the codes, the common use codes for clinical and non-clinical type site-based testing. You would be able to choose that here, and you would enter it in on the front of the page of the form underneath the site type or site location. If you are meeting any of these criteria as far as the settings that you are providing the test in. Then underneath that is the assurance of confidentiality statement. That is from CDC and from our state code.
Okay, so value definitions for diagnoses, letter C on your screen. These are guidance that you can use for verifying if a client is a new diagnosis, has a new diagnosis of HIV or previous diagnosis. It gives you some of the indicators for self-report, what documentation can be used to determine one way or the other. Verifying in surveillance is the most surest way, so that is the first, I believe the first one, new diagnosis verified, meaning you have checked surveillance and that client was not found in surveillance. So that's when you would flag this as a new diagnosis of HIV. So these instructions are provided just to give you an idea of what sources or what resources you can use to make that determination to complete that portion of the HIV test form.
And the next section, you see those boxes. This is where your additional stickers will be for blood draws or to add to any tests that you're running to have the idea from the form correlate with the test you're providing. You can use that on the test kit, or you can use this as the stickers you previously had with the Part 1 forms to send off to the lab for blood testing. And just to give you a reminder, this is the form that is replacing the Part 1 and Part 2 forms. Also, this is a form that replaces our confidentiality form that we had used for HIV rapid testing. So this is a conglomeration of those three forms into one form, one easy-to-use form for everyone.
And lastly, we know this is new to a lot of you, so we wanted to be able to provide you with some resources you can use to help during the transition from the form you're currently using to this new form. So from CDC, we have put together a data collection and reporting guidance document. The document provides information on how to collect the variables we just ran through in the webinar. It also provides some justifications on why we added certain variables to the test form this year. That document also includes a requirements table. This table is sort of a matrix that lists out all of the variables on the test form and where it is appropriate to collect the variables, whether it's in a healthcare setting or non-healthcare setting. And once you get familiar with this table, you will find that certain variables are not required in healthcare settings. If you can collect that information, we encourage you to do so. But based on what you see in this table, you can make the judgment as to whether something is required or not required. The last resource listed here is what we call the DVS, the Data Variable Set. It is a document that contains all of the variables that are current for an HM&E data collection their value options, and the code, their corresponding code also includes instructions and some basic definitions of the variables. These documents are available through our NHMNE Service Center. You can also contact Sean or someone at the state if you need access to these variables. To these resources.
And just want to give everyone a reminder, I know Carol and I have stated it several times, but fill out as much as possible of this form as you can. If you cannot, no lightning will strike you, we promise. And you would be able to fill this out. Not only as helping us, but it will also help you. And as you are working through this with your client and working with the counseling with your client, this will help you as well. If you are offering anonymous testing, as we stated before, I just want to reiterate this. You do not have to enter any identifiable data, which is name and address, etc., but you still need to identify if the test was a positive or a negative. And if it's a positive, we are required report state, so you would then need identifiable information so they can be linked to care.
We will now open the phone lines for any questions. So if you have questions, please unmute your phone.
Hello, it's Candy from Canal Charleston. I have a question on the agency information. Are these forms, do they come in with, are they carbonated? Are they carbon papers?
The first sheet is very similar to how the Part 1 form was done. The first sheet, as you can see from the one I emailed everyone, there's an exactly same copy behind it. There will be a copy, a carbon copy behind that you can give the client once you've completed the testing, that they could take with them with their test results.
The reason why I was asking is because I'm trying to make it a little easier for when we see people in here, if we can go ahead and get the forms pre-printed with our information already on there, with like the CLIA number and our agency number and things on there, so we don't have to write those in and maybe have a number maybe transposed or anything. Is that possible, or do we have to go through and write everything on there already?
What you can do with your CLIA especially, we have been using these for a while in Cabell County. What they do, they have a stamp, and they stamp all those areas so they don't have to write them in. You can also get stickers and put where their CLIA ID is. Yes. And if you want the sticker where this other information is, that would be acceptable as well.
So just put it over top of that whole thing.
As long as it provides the information and what it is, yes.
Okay. And is that that's just that one page? So that's just the one there.
Yes.
And
when the carbon copy page that you're giving to the client, you would not have to have all that on there. So if you don't want to do that on both of those, that's fine, as long as it's on the one that comes to us. As identifiable so that we can enter your information in the evaluation web correctly, that would be fine.
Okay.
But like I said, at Cabell they have a stamp that they actually use in each one of the sections. Instead of having to write each one in, they just stamp those sections, and they do them in a group and provide them to their nursing and medical staff for HIV testing.
Okay. Thank you. That answers that one. And then my second question, in client demographics, you said if they do not know the date, we can use 1800 as a year. What about the month? Just put it. I'm sorry, I probably didn't hear that.
No, I did not mention the month, and on the screen it shows question marks because it depends on how the state wants you to record that.
Okay.
Is it okay for them to default the month to 01?
I think what we've told them is January. To default if they do not know the month or the year, but they have had it and you want to put, we asked if you put something there if you can. I would default it to January 1800.
Gotcha. Okay. Thank you. That's all the questions I have. That's something we have to do on our state lab. Thank you.
You're welcome.
Are there any other questions from the phone line?
Yeah, this is Crystal from Lewis County. When will we be getting the forms?
Good question. We are in the process now of getting them out to be printed. We were hoping to start this earlier, about January, but it looks like maybe, hopefully, no later than March, we'll have the forms back and out to y'all. But there will be a grace period, which I forgot to mention, after we get these out to y'all, that we will still accept the Part 1 forms and Part 2 forms. But that will be a very short grace period, because then after that we will not be accepting the old Part 1 and Part 2 forms once we have these out to y'all and you begin to use them. And you'll see as you use these in your practice, they work really well. They've worked great in Cabell County. They actually have been, they really like them. Like I said, there will be a grace period after we get this out to y'all if you still have Part 1 and Part 2 forms. And we will accept this for a very short period of time, and then after that we will not accept the old forms. But we are hoping no later than March to have these out to everyone.
And I see where Rachel says she has a lot of questions, but she's not able to connect to audio and wants to know if she can contact Sean after the webinar.
Yes, you may.
And it's okay if you don't have questions now, because we know this is a lot of information and you're just getting this information, so you may need time to review the content, digest the content in order to formulate questions. We will have the webinar recording available sometime next week, along with all of the questions that were asked on yesterday's webinar and today's webinar. So we'll compile those questions and create a companion document to go along with the recording, the webinar recording. So that will be available sometime next week. And the intent behind the webinar is for you to be able to use it maybe as a refresher, or if you have new staff coming on board, use it as a training tool for new staff as well.
And we will also be working on a YouTube video, which hopefully will be available in the beginning of the new year. And we will send the link out to all of y'all to be able to use that as well as a training tool for your new staff. Or if you just need a refresher and you're like, oh gosh, I can't get a hold of nobody, but I need to know how to fill that out, you can go to the YouTube video, which will explain step by step how to fill the form out and what you need to put in all the different sections.
Hi, this is Kathy with Wexford Health Sources. I just want to check and make sure, are the forms going to be sent out to all the sites, including prisons, or do we need to order them?
The first influx of those, we will be sending them out to everyone. Then after that, you would order them like you typically did the Part 1 and Part 2 forms after that.
Okay, thank you very much.
You're welcome.
Last call for questions. Are there any additional questions from anyone? All right. Well, we really appreciate everyone taking the time to call in and listen to us after lunch. So if you have questions that you need to ask after we sign off, you can email Sean. If he can't get the answer, if he doesn't know the answer, he'll be sending it around to someone. So we'll get an answer from someone for you.
And if there's something you would need to ask of Carolyn, just send that to me, and I'll filter those. If I can answer it, I will answer it. If not, I'll forward it on to Carolyn, and she'll be available to help us as she can. You ain't getting away that easy.
And Rachel needs to know your email address.
Okay, my email address is actually, as an employee of the state, it's our names at WV.gov. So my name is Shawn, SHAWN, .G as in good, .B as in boy, ALLEY, D as in dog, IER, at WV.gov. And you are more than welcome to email me any questions or concerns or anything anytime.
Hi, Sean. This is Rachel Baumgartner. I actually was able to get on the audio.
Oh, hey!
I know. I was all excited. I was like, I made it. Yes. I'm so excited. I'm actually just going to go ahead and email you because I have a lot of questions.
Okay.
And I don't want to hold up everyone's time, but I really appreciate you all providing this WebEx for us.
You're very welcome.
Welcome. Well, we're glad you're able to get the audio working. All right. Well, if there are no other questions, thanks, everyone.
Thank you all so much, and we all hope you have a happy holiday and safe and happy travels to wherever you'll be going for your holidays. And be looking for the forms coming in the new year, and we will be here to assist you through this. We are not going to throw you to the wolves and leave you by yourself. So we will be here to help you through this and through the transition to this new form to replace the 2 previous forms. So we hope everyone has a great holiday, and thank you so much.
Thank you.
Thank you.